we are going to discuss bloodborne pathogen, infection, and control measures. The objectives of this lecture include the followings. First, we are going to define what is the meaning of the bloodborne pathogens, and then to review different bloodborne pathogens and discuss the epidemiology of the bloodborne pathogen and study or identify the risk factors for transmission and identify and describe the three types of bloodborne pathogens which are of most concern. Bloodborne pathogen, they are a group of microbes that may present in human blood and other potentially infectious material and cause human diseases. These diseases, they are not transmitted through casual contact. That means they won't get them by shaking hands with an infected person or by using the same articles or fomites, bathrooms, or kitchen facilities. The body fluid and the potentially infectious material or pathogens include the following: blood, semen, vaginal or cervical secretions, saliva, breast milk, and fluids that surround our internal organs, such as cerebrospinal fluid, synovial fluid, pleural fluid, amniotic fluid, pericardial fluid, peritoneal fluid, and wound drainage. Most common three types of the bloodborne pathogen include hepatitis B virus, human immune deficiency virus, which cause AIDS, and hepatitis C virus. With any of these diseases, it is possible that at least some infected people may look and feel well, no sign and symptoms for years, but despite this, they can still potentially infectious for other and may develop serious disease. So although they don't show sign and symptoms for a long period of time, but they can transmit the infection to other people. The factors which may involved and in the risk transmission include frequency of disease occurring in the population, such as the incidence and the prevalence, the viability of the organism, how long it can survive, or the presence in the body. For example, hepatitis B survive in dried blood for up to 7 days. The viability, sorry, outside the body of the human body. It can survive. The hepatitis B virus can survive in dried blood up to 7 days outside the body. The length of time that the infectious agent remain in the blood, how long it remain in the blood, and the source person's viral load, the number of virus particles present in the blood, or it is called the viral load, which may cause the infection to others. Its virulence, the virulence of the microorganism or the virus, that means the ability to cause disease to other people. And lastly is the susceptibility of the recipient. The recipient اللي هم they are the individuals who got the infections, and the susceptibility, there are some individuals they are more susceptible than other people. For example, immunocompromised individual, they on steroid or chemotherapy, or they have lower immunity for many different causes. It make them more susceptible to the infection. Hepatitis B virus, it is an acute infection of the liver, acute viral infection of the liver, and this infection lead to the inflammation and necrosis of the liver cell, or death of the liver cell, it lead to fatty changes, and it lead also to cirrhosis of the liver, and later on it is have the complication of liver failure. It is commonly found in a human population, so it is a disease of human. Only human have this infection. The prevalence varies by race. There are certain racial factors which make them more liable to have the infection: ethnicity or the ethnic group, age group. Some people or some age group, they are more likely to have the infection rather than other. For example, the baby inside the uterus of the mother, during pregnancy, he can get the infection from the mother, or he can get the infection through the passage of the birth canal, or he can get the infection in the postnatal, in the after delivery. And the other risky group, they are the sexually active people, which is from the age of 18 up to 45 years at the middle age. So they are called the sexually active people. They are more likely to have or got the infection. Geographical location, there are certain areas which are more liable to have the infection rather than other. And individual history of risk behavior. The risky behavior, some people who have, for example, what is called promiscuous sexual relationship, or extramarital relationship, or what is called illegal sexual relationship, they can get the infection, especially if they have many partners, and if they have unprotected sexual relationship. A drug addiction, especially the IV or intravenous drug addiction. People who shared the needles, they increase the risk of the transmission of infection. Certain occupations, it makes some employee or some worker, they got the infection because of their occupation, such as the health worker personnel. The epidemiology of hepatitis B virus, it is an endemic in human population, and it is sometimes hyper-endemic in many parts of the world. If the prevalence is more than 8% of the population who they got the infection, this is called hyper-endemic. Natural infection seen only in human, as we mentioned, it is a disease of a human. Does not affect animal, or it is not zoonotic disease, but it is a disease of a human. The rich people or poor or rich countries, they have differ in the age and modes of infection. There are some people who are called carriers. The carriers, they are defined as people who have the infection or carry the microorganism, but they show no signs and symptoms, or they are asymptomatic, or they have subclinical condition, and they can transmit the infection to others, although they are asymptomatic or healthy or subclinical. The significance that they can transmit the infection for other. The transmission of the virus, hepatitis B virus, is either by parenteral transmission, that mean by injections, different methods of injection, whether intramuscular or IV, or by the contamination of broken skin with contaminated equipments. Perinatal transmission, that means the baby have the risk to get the infection from the mother, either intrauterine or what is called transplacental transmission of the infection from the mother to the baby through the umbilical cord and the placenta, or during the passage of the baby through birth canal, that is called natal, so prenatal and the uterus, natal through the passage of the baby through birth canal, or Postnatal, if the baby may contract the infection after birth. Other method is by sexual transmission. This hepatitis B virus is regarded as sexual transmitted disease, and the disease is transmitted through oro sexual relationship, and it is regarded, as we mentioned, as one of the sexual transmitted disease. The route of infection include either vertical transmission or horizontal transmission. The vertical transmission means that the infection, which is the perinatal transmission from the mother to the child through the birth canal, or the horizontal transmission, which is transmission of the infection through the sexual contact or the intravenous drug use. The prevalence of the chronic hepatitis B virus infection in area of high endemicity is greater than 8%. So as we mentioned, if the prevalence is more than 8%, so it is called hyperendemic area. After the infection with the virus, with hepatitis B virus, the patient will develop what is called hepatitis B surface antigen, circulating in the blood within several weeks after the infection starts. And it is one of the earliest signs of hepatitis B infection, or it is regarded as a diagnostic test for hepatitis B virus infection. Although hepatitis B surface antigen has been detected in multiple blood fluid, but it is present in the serum or blood in high concentration, and with a lower concentration in the saliva or in the semen. A positive or reactive hepatitis B surface antigen test result means that the person is infected with hepatitis B virus. So the presence or positive hepatitis surface antigen, that's B surface antigen, means that the patient or the individual is infected and he can transmit the infection to other people. This test can detect the actual presence of hepatitis B virus, called the surface antigen, as we mentioned, in the blood. And if the person tests positive, then further testing is needed to determine if this is a new or an acute infection or a chronic infection. A positive hepatitis B surface antigen test result mean that the person is infected and he can spread the infection to other people through blood or through other potential infectious material. After the infection with hepatitis B virus, as we mentioned, and the patient develop hepatitis B surface antigen, then the individual may develop what is called hepatitis B surface antibody or antibody to the antigen. So a positive or reactive antibody hepatitis B surface antibody test result indicate that the person is protected. So if the patient develop antibody against hepatitis B surface antigen, so it means that the patient or the individual is protected against hepatitis B, or he is immune against hepatitis B. He will not get the infection. This protection can be resulted from receiving hepatitis B vaccine or successfully recovering from a past hepatitis B infection. Most of us have hepatitis B vaccine, and if you have this vaccine, so you will develop the anti-hepatitis B surface antigen or antibody, sorry. So that means you are protected against hepatitis B infection. Or In some cases, who resolve or get a cure from acute infection, also or recover from hepatitis B infection, so they will develop a hepatitis B antibody, surface antibody. This test, but actually, this test is not routinely included in a blood bank screening. A positive anti-hepatitis B surface or hepatitis B surface antibody test result means the individual immune and protected against hepatitis B virus and cannot be infected and cannot infect or spread the infection to other people. So hepatitis B can cause both acute and chronic disease. The virus is transmitted, as we mentioned, through contact with the blood or other potentially infectious material or body fluid of an infected person. It has been estimated that nearly quarter a million, or sorry, 240 million people are chronically infected with hepatitis B, as defined by the presence of the hepatitis B surface antigen at least 6 months. And more than 686,000 people die every year due to complications related to hepatitis B, including cirrhosis or liver cancer. So this virus or hepatitis B virus, it is one of the viruses which cause cancer or lead to cancer. However, it can be prevented. This is an important point that the infection can be prevented by effective, safe vaccine given early in life. The risk of hepatitis B infection is increased if the individual have unprotected sex with many one partner or many or multiple partner who have the infection with hepatitis B virus, or it is high the people, homosexual individual, they are more likely or at risk of having the infection, and also individual who share needles during intravenous drug abuse. Individual or drug addict, sometimes they share the injections or the syringes for having the drug intravenously, and this may cause a transmission of the infection. Also, there are certain occupations which make people are at risk of having infection, and it is regarded as one of occupational diseases. So the most common employee who got the infection or at risk to have the infection include the health worker personnel, healthcare worker or healthcare personnel such as doctors, nursing, dentists, and laboratory worker, and also another risky occupations such as the hairdressers. Also, the individuals who receive hemodialysis for the end stage of kidney failure or renal failure, they are at risk of having the infection, and also babies born to mother with hepatitis B virus, also they are at risk of having the infection. Why is hepatitis B a health concern? Many people infected with hepatitis B virus, they don't know that they have the infection because symptoms can take 2 to 6 months to appear. Only about 50% of people may develop symptoms. During this time, they can't transmit or spread the infection to other people. They may not know that they have the infection until the complication occur for the patient. So the potential complication, as we mentioned, from chronic hepatitis B virus infection include cirrhosis of the liver or fatty changes of the liver and liver failure and liver cancer, and sometimes it leads to premature death. Sign and symptoms, it ranges from no sign and symptoms to fatal hepatitis. Some people, as we mentioned, they don't show sign and symptom, and some people sometimes they have fatal complication to hepatitis. The incubation period vary between 45 days up to 180 days. Only 30 to 50% they have, the majority they don't have symptoms. 30 to 50 they have no symptoms. The other may present with malaise, fever, macular rash, jaundice, thrombocytopenia, that means reduction in the number of platelet and leading to bleeding tendency, nausea, vomiting, arthralgia, arthritis, anorexia, dark urine due to bilirubin, and acute liver failure. The risk of hepatitis increase from percutaneous exposure. It requires high amount of the virus in the blood, which have the amount of 10 to the power 2 up to the 10 to the power 8 viral particle per ml of serum or plasma compared to other blood. So it is a highest risk for causing the disease, and it is highly infectious. The concentration of the virus vary in the body fluid. It has been noticed that it have high concentration in the blood or serum or wound exudate, and lower or moderate amount in the semen and the vaginal secretion and the saliva, but it is of low concentration in the urine, feces, sweat, tears, and breast milk, or maybe it is not detected in the last group. The treatment and the prevention, there is no specific treatment exists for hepatitis B. Acute hepatitis B infection fails to resolve, and instead it progresses to chronic hepatitis B infection. So, the chronicity of the disease or the infection depends on the time of the attracting the infection. So, the earlier the time of having the infection, the more likely that the individual will develop chronic infection. For example, it has been noted that 90% of those who got the infection and during infancy, they will have a chronic infection. And 30% of children infected at the age below 5 years also, they will have a higher risk of having the chronicity, while only 5% or less than 5% of persons will have or develop chronic hepatitis, especially if they got the infection after the age of 5 years. Also, it has been estimated that approximately 25% of persons who become chronically infected during childhood and 15% of those who become chronically infected after childhood die prematurely from cirrhosis of the liver or cancer. We are going to discuss the prevention strategies or preventive strategies in the next lecture. How can we prevent the transmission of the infection or decrease the risk of the infection from the mother to the newborn? This can be reduced by, if the mother is a non-case or carrier of hepatitis B virus, so it is important to give the newborn hepatitis B vaccine first dose and hepatitis immunoglobulin immediately after birth or within the first 12 hours after birth. So, the first thing, if the mother is carrier or infected with hepatitis B, a non-case of hepatitis B, so we can give the baby or the newborn first dose of hepatitis B vaccine, and with the accompanied with hepatitis B immunoglobulin within the first 12 hours of birth. Then it is followed by a second dose of hepatitis B vaccine in a period of 1 or 2 months after the first dose. Then a third dose, it should be given also within not within the first 6 months, and which mean not after 6 months. So within the first 6 months of life, he should have 3 doses. Then it has been studied that or estimated that 2% of infants vaccinated will not develop immunity after this first 3 doses series. So, infants for a positive carrier mother or positive to hepatitis B mother, the baby should be tested at the age of 9 months for the hepatitis B surface antigen and antibody. If he if post vaccine is still susceptible, if the patient if the baby is still susceptible after the first 3 doses, so we are going to give another second series of the vaccine, which is also composed of 3 doses: 0 dose, first dose, and the first month 1 month after the first dose, then the other one after 6 months. Also, it is given to the baby. So, but if the baby is still susceptible after the second series of the vaccine, a third series is not recommended. The vaccine is administered into infants, provides protection for 90% of individuals. That immunity lasted up to 25 years. According to the World Health Organization, they recommended to give immunoprophylaxis starting from the newborn. So, if the mother is positive to hepatitis B virus or carrier, so multiple injection of small doses of hepatitis B immunoglobulin should be given to the baby, or oral antiretroviral or antiviral should be given to the mother during pregnancy, who have the highest infectiousness, which when she has a viral load which is more than 6 to the power 10 to the power 6 per mil in late pregnancy, for the last at least for last 3 months. So according to the World Health Organization, there are two regimes. So it recommended, so either we give multiple immunoglobulin to the baby after birth, or we give antiviral such as lamivudine given to the mother, carrier mother, during pregnancy, especially for the last three months of the pregnancy, or what is called in the last trimester. Pregnancy and hepatitis B vaccine. It has been some studies. They mentioned that hepatitis B vaccine, it can be given to the mother during pregnancy, and it have no risk to the fetus. He will not develop any side effect to the vaccine, and it has, because they mentioned that this vaccine have or contain non-infectious hepatitis B surface antigen and should not cause risk for the fetus inside the uterus. Another infection is hepatitis C virus or hepatitis C. It is caused by virus, hepatitis C virus, and it is acute and it can be severe disease. It is a major cause of acute and chronic disease, including cirrhosis and cancer, and it is also regarded as one cause of liver transplantation because of liver failure or liver cirrhosis. The incubation period, it range between 2 months up to 6 months. 2 weeks up to 6 months. The virus usually takes 1 to 2 weeks to multiply in large enough volume to be detected by the laboratory testing. It had the same sign and symptom from cannot be distinguished from hepatitis B. The prevalence of hepatitis C infection among healthcare it is nearly 10 times lower than that of hepatitis B virus infection. Hepatitis C virus can survive outside the body at room temperature on environmental surface for at least 16 hours but no longer than 4 days. So as compared to the hepatitis B virus hepatitis, so which we mentioned that the virus can survive up to 7 days outside the body. Hepatitis C virus can only survive between 16 hours up to 4 days. The sign and symptom, as we mentioned, it is similar to that for hepatitis B. And one of the most dangerous aspects of this disease is that 80% of persons infected show no signs and symptoms until the disease is quite progressed. Chronic disease occur in more than 70% of cases. The transmission of hepatitis C virus primarily method is by parenteral or through by injection, mainly by injection. Other method it can be also transmitted by body fluid and mother to baby at the time of delivery. But transmission by sexual and among family member it is not known. So it has been mentioned that it is not transmitted by sexual transmission or between the family members. The risk of a transmission with percutaneous exposure it require less viral load than hepatitis B virus, which is between 10 up to 10 to the power 6 viral particles per ml of blood or body fluid. So lower percentage of exposed person then convert from healthy persons to disease compared to hepatitis B virus. So it is less infectious. Human immune deficiency virus or AIDS present itself in a broad spectrum of disease of sign and symptoms and the clinical course. It is an emerging disease. It is firstly emerged in the 80s. I think it was at 1986 was first diagnosed at that time, and then from that time up to now it have a large number of people have this infection. Regarding incidence and the prevalence, it is asymptomatic. Sometimes it is asymptomatic, but most of people may present with the virus cause acquired immune deficiency syndrome or the abbreviation of AIDS, which result in severe end stage, often with opportunistic pathogen. This virus cause immune deficiency or affect the immunity of the person, of the patient, and it make the person is more likely to have opportunistic infection or many types of infection or pathogen, which sometimes it is fatal. The sign and symptoms varies from mild up to severe. Either the patient may develop lymphadenopathy and hepatomegaly, recurrent persistent upper respiratory infection because of the low immunity, sometimes the patient have anemia, thrush. Thrush means the candidiasis or infection of the mouth with the candida albicans. Also, the patient may have recurrent or chronic diarrhea because of infection or herpes simplex. Different types of infections and may cause or sometimes have bacterial infections such as pneumonia or sepsis or septicemia. The severe cases may present or have develop encephalopathy, histoplasmosis, which is infection, fungal infection of the lung, which is spread to other parts of the body, or the patient may develop lymphoma, which is the abnormal growth of the tissue of the lymph system, and some patients may have Kaposi sarcoma. So also AIDS or human immune deficiency virus, it is one of the virus which cause cancer, or regarded as a causative factor for cancer. So a patient may develop what is called Kaposi sarcoma, which is it is a sarcoma of the skin which may penetrate into the muscles and to the bones or other organs. The patient is more likely to develop pulmonary tuberculosis because of the low immunity, and this is called the dual infection, and it is severe complication and may result in death of the patient. The transmission is only non-reservoir. Human is the only reservoir of the infection, and it was, as we mentioned, it is emerged during the 80s, and the first attracted it was from. They believe that it is from the chimpanzee. The virus remain in the infected person for life. Incubation period approximately 12 up to 18 months. It is the most infection is the infection is mainly by infected body fluid involved in the epidemiological transmission, such as blood, semen, vaginal, anal, or orogenital sexual contact, human breast milk, contaminated needles or sharp instruments, mucous membrane exposure by sexual contact, mother to child during pregnancy, time of labor and delivery, and breastfeeding after delivery. So it is also one of the viruses which are transmitted perinatally, which means before birth, during birth, and after birth, or by breastfeeding. Human immune deficiency virus is very fragile and will not survive very long outside of the body. So this is one important point in the control or transmission, control of the or prevention of the infection. So the virus cannot survive very long outside the body. The reduction in mother to the child transmission of a human immune deficiency virus is regarded as one of the most effective public health initiatives. So, as a public health concern, is the transmission, prevention of the transmission of the infection from the mother to the child. In the absence of a treatment, the risk of vertical transmission of HIV is as high as 25 up to 30%. So the mother to infant transmission can be decreased by the following. First, by the implementation of prenatal HIV testing. That means every woman should have the screening for HIV testing before pregnancy. So it is one of the important screening test for the mother before she have the pregnancy, especially in the developed countries, because the risk of having this infection is higher. So every woman should have or should be tested for HIV before pregnancy in the prenatal period. The second way to decrease the transmission of the infection from the mother to the baby is by the administration of antiretroviral during pregnancy and labor and then to the newborn. So the administration of antiviral during pregnancy and labor and after that, or delivery by cesarean section or elective cesarean section. So we deliver the mother by cesarean section before she go to birth, and discouraging breastfeeding So the mother, if she have AIDS, she should not breastfeed her baby. And thank you.